Hello, I'm Michael Pierce, and this is The Human Condition. Today we're talking about natural treatments for insomnia. Insomnia is a complex problem and we can't solve all of it all the time, but I think there's a lot we can do for most people with very inexpensive and non-invasive methods. So I'd like to talk about that and I'd like to try. When you look at insomnia, there's really three factors that I think most of us really look for in natural medicine. And the first is falling asleep. The second is staying asleep or reawakening during the night. And the third is waking rested. Sometimes you may notice that your problem is that you can't fall asleep, but you stay asleep throughout the night perfectly fine. Other people will notice the opposite. They'll say, I can fall asleep great, but I wake up at 2 a.m. or 3 a.m. or 4 a.m. and I just can't stay asleep. And others have both. And others have really neither, but they just don't wake up rested. They wake up tired and they say, I can't identify what's wrong with my sleep because I feel like I fall asleep quickly and I don't wake up in the middle of the night and I sleep 8 hours plus, but I wake up tired. So those are the three general problems that the most common type of person might run into. And I'm not a sleep specialist. There's other sleep specialists that deal with specialty disease assessments, and it's a great idea if you've got a terrible sleep disorder to go to a sleep lab and get a proper sleep EEG where they measure your brain waves and you actually lay in a bed and sleep and you stay there for the whole night and they measure all of that stuff. It's very, very useful for the rare and difficult cases, but most of you won't need that. So what are the mechanisms behind falling asleep and staying asleep? Are they different or are they the same? Well, it turns out we know a fair amount about falling asleep, and generally what has to happen in order to fall asleep is you have to have melatonin. You have to have an amount of melatonin in your brain that's manufactured from serotonin, and that serotonin is manufactured from protein and from minerals. So you've got to have all of the healthy proteins like tryptophan and you've got to be able to have iron, and you've got to have magnesium, and you've got to have zinc, and you don't want to have a terribly high blood sugar. So it's useful to make sure that you don't have insulin resistance and that you can make sure your body is making melatonin. If you're a healthy person, when you go down to fall asleep, you should fall asleep in 10 to 15 minutes without a real problem. And if you stay awake longer, then you might have a falling asleep problem. Many people will take around 3 milligrams of melatonin to fall asleep, but they find that over time they have to keep doing it and it doesn't work anymore. And that's because there's a negative feedback loop in the brain where if we take melatonin, sometimes our bodies will make less of it. Melatonin can be very useful for some people to counteract cortisol because melatonin and cortisol have a rhythm where melatonin is helping you fall asleep at night and cortisol is helping you wake up in the morning because it peaks around 7 or 8 a.m. and it corresponds to our blood sugar control and our ability to wake up and mobilize blood sugar so that we can wake up without food after being asleep for 8 or 9 hours or 7 hours and maybe not eating for 12 hours or longer. Many of us do fasting, and we fast for 16 hours doing an intermittent fast. So what helps us wake up is a very good cortisol surge that happens around 7 or 8 a.m. So what happens when people wake up between 2 and 4 a.m. or 2 and 5 a.m.? Well, that's usually an adrenal problem of some kind. And in some cases it can be the liver, but generally it's the adrenal system where the person has some kind of problem with either blood sugar control or adrenal regulation or dysregulation, where they start making too much or too little epinephrine or too much or too little cortisol at the wrong time. And that wakes them up. So that's not so much a melatonin problem. It's more an epinephrine problem. And we don't know with you whether it's high epinephrine or low epinephrine. And there are ways to regulate that. You can help your adrenal glands if you're waking between 2 and 5 a.m. using vitamin B5, pantothenic acid. You can use magnesium, you can use tryptophan, and you can use iron and zinc. These are useful molecules that are useful to help you make those hormones, make those neurotransmitters. You need serotonin, melatonin, epinephrine, and you need cortisol. So those all require things like omega-3 fats and the minerals I just named. The ability to make epinephrine is dependent on dopamine. So if you don't have enough dopamine, you can't make enough epinephrine, and you may have trouble not just sleeping, where you wake up in the middle of the night, you may have trouble learning, because epinephrine is a very powerful learning neurotransmitter. If you don't have epinephrine, it doesn't help you have the reward cascade. And dopamine also is involved in that reward cascade that helps you feel a sense of reward that you've accomplished something. That feeling of accomplishment and self-esteem comes from dopamine and norepinephrine triggering parts in our brain that make us feel, I've accomplished something. I've done something good for myself. And so a person needs to make sure that they're getting the adequate proteins and minerals and vitamins. In fact, probably the most famous vitamin for the adrenal glands is vitamin B5. Many Americans are deficient in B5 because they take supplemental folate and B6 and B12, but they don't get enough B5. One of the things we do in our clinic is we do a flank percussion test, which is where we put our hand over their kidney area and their adrenal area, and we gently, with a loose fist, tap or thump our fingers right over that kidney. So the person will be sitting down or laying down, and we put our two fingers right over their adrenal gland and kidney, and we're screening for things like kidney infection, kidney stone, adrenal inflammation, which is what we're looking for in this case. And very often these people will feel a 2-finger wide pain right around their ribs on one side or the other, and often one side is worse than the other because that adrenal gland is swollen. And so when that happens, you'll see the person just jumps and says, ow, that hurts, it feels like you're punching me. And they think that they've injured a rib or something, and it's not a rib injury, it's almost always a adrenal gland or a kidney. There's ways to eliminate the kidney from the picture by doing urine tests and making sure that blood and urine tests are normal. And in that way, we can differentiate between kidney and adrenal. Lastly, if you're not sleeping, you might have problems with an obstructed airway. And as I've said in other videos, look at the mucus-producing foods, which are sugars, refined sugars, grains, dairy products, and allergic pollens in the air. Those are things that can trigger you and set you off. So try to reduce grains and beans and nuts and seeds, and look at your airway and see if this swollen airway could be a cause of that. A number of my patients have mouth breathing problems where they don't know that mouth breathing is not normal. When they sit quietly doing something that is not athletic, they are breathing through their mouth, and that's not normal. There's something wrong with the airway because they should be sinus breathing. They should be breathing through their nose. So there's a movement of doctors that have endorsed taping the mouth shut during the night to force the person to breathe through their nose. And that's a neat idea, and it works for some people. The difficulty is if you've got swollen airways because of a food allergy or food sensitivity, that's just going to give you worse sleep apnea and give you low oxygen perfusion during the night. So it would be wiser to do an elimination diet for several weeks to try to get rid of all those proteins and inflammatory fats and inflammatory sugars that are causing the swollen turbinates inside your nose. So just remember that airway can be a problem for insomnia. And after a person takes some of these supplements, they may find that they wake rested and they feel like they're fresh as a daisy.